So once again, we have Dr. Stacey Brown here in the studio. Thank you, Dr. Brown, for being with us.
Air bump. Yeah,
yes, that's as close as we're getting. So you can see we are masked up today.
Yeah.
Or if you're listening on radio, yes, we are wearing our masks.
And we're like our social distancing 6 feet apart too. So very happy to be back, Bill. I think a lot of stuff has changed since we talked last.
The whole world has changed in the week since we talked.
Yeah, I remember we had talked earlier about kind of surveillance and how we were doing a lot of surveillance testing for whether COVID was in our community or not. And now we know we've got positive tests. You've been reading the papers, and so now we're definitely into kind of containment mode. So it's just kind of like, well, we're example for today, experiencing that today.
Very good.
Yeah.
So. My goodness, like we said, so much has been going on.
Yep.
The last time we spoke about the PPEs, and we were in good shape with PPEs.
Now we still are. You know, we're the nice part is that we started this at an early point, right? So we decided that we were going to really control the supply lines, make sure that we had enough PPE for our healthcare workers to do the job safely. And we've stuck with that. We've really taken a close eye and made sure that we have enough supplies. Manufacturers, are getting really stretched thin. Luckily, we have something called a regional group called a MOAC, which is state-based, and so they have some supplies that they end up giving us, even though we didn't count on that. That's kind of like a little Easter egg coming up. So we're actually doing pretty well. Masks are doing really well. The N95 respirators that the healthcare workers do to try to stop the aerosolization or the droplets that come out of our respiratory tract when we're doing aerosol generating procedures. Like if we're doing a nebulizer, if you have asthma, or if it looks like, God forbid, you need to, put a tube in and mechanically ventilate. Those are the kinds of things that we end up doing a lot of. So those are still in good shape. The surgical masks, the ones that you're sporting today, are still in good shape. Those are really helpful for just a source control. So if somebody comes into the hospital and we end up thinking, maybe we need to test them for COVID or not, we'll put a mask on them if they have any symptoms that may be related to COVID. So we now have a screening tool at each point of entry in the district. So they're going to ask you those same kinds of questions we did before, minus the travel, because we really don't care about travel right now because it's kind of community spread. And since it's community spread, a lot of the known contact information is kind of scrubbed or taken away from that screening questionnaire too. So it's really going to be about symptoms. Do you have a fever? Do you have a cough? Do you have a sore throat? Even some of the unusual presentations of this, like diarrhea that's within 48 hours. Those are all going to be questions that you get asked at the front of any point of entry into the hospital. Clinics, radiology, infusion, if you've got a surgery planned, all of those points are going to be using the same screening tools.
Very good. I know when I still had physical therapy, they were asking me those questions when I checked in there. They were doing their job, their due diligence at this hospital. It's very impressive.
Yeah, we try to stay on the, kind of an even keel here, getting those essential services that you need, done. If you break your leg, we're going to fix your leg. We just want to make sure it's safe for you and also safe for the rest of the staff in doing that. Which
is part of also, I assume, the social distancing, staying home. You're not out crashing your car. You're not hiking and breaking your ankle. So that the facilities and the staff and all that are available for the people that really need it.
Yeah, and we want to keep it that way. A lot of what I hear is, it's not really in town yet. I'll kind of go do my own thing. And now we have, as of, today, April the 3rd at 11 o'clock, we have 2 patients in the hospital that have, suspected COVID. So if those beds and resources are getting taken up by folks that aren't doing the right thing and getting a respiratory infection that could have been avoided by social distancing or isolating themselves at home or home quarantine like we're recommending, then, that's taking up resources for people that get into an accident. I'd hate for somebody to break their leg and they, couldn't get the care they need because the hospital is so full of people with respiratory problems from COVID that we could have prevented in the first place.
Very good. So yeah, please stay at home. Hand washing. Notice when you came in, you hit the hand sanitizer. And this morning when I was doing my my wipe down that I do every morning.
Yeah, high touch surfaces.
I wipe the top of the hand sanitizer.
Oh, yeah.
So we're not recontaminating every time we use that.
Yeah.
Of course, sanitizer would take care of that.
Right.
I see you're wearing a reusable mask.
I am. I'm wearing a cloth mask. And again, a plug and a shout out to all of the sewers and the quilters that have mobilized in the town to end up getting the healthcare workers and the rest of the folks in town these these fabric masks. This is really kind of like taken a life of its own. If you look at anything in the press right now, New York Times, Guardian, Atlantic, they all have different patterns for these things. So we started this about 2 weeks ago because we kind of saw the where this was headed, and we mobilized our local folks, and they've done a superior, just a great job at cranking these things out.
And this is headed by Barb Stuhan?
Yeah, Barb Stuhan at the old hospital nurse that you used to work with in the operating room, I believe, yeah?
I did. And no one knows more, I don't think, or much more about all those sterile procedures and all that good stuff than Barb Stuhan.
Yeah.
She lived it for, not to say too much, but for a long time. She's very experienced.
But these are great. I mean, they have a role, right? What the fabric mask and the cloth mask really have a role is to preserve some of the personal protective equipment that hospital workers or first responders, wilderness first responders, EMTs, paramedics, they're going to need those surgical masks and those N95s. And so the general public can end up, doing their part by using something that's reusable, not wasting a paper mask, and kind of keeping that in circulation for the other healthcare workers. We certainly don't use these fabric masks when we're taking care of patients that require something more. Like if I have a suspected COVID patient that I'm caring for, I'm not going to be wearing one of these. I'm going to be wearing the appropriate paper, disposable N95 or surgical mask that I need to. But these are a great addition to preserve that supply. And I think what it does too is it allows a lot of folks that are wearing this kind of a couple of different things. One is that if you think of how this thing gets spread, it's a respiratory droplet. And there's some decent, studies out that, every time we talk, these little respiratory droplets kind of like fire out, like, a pitcher in a ball game. Mm-hmm. And we don't want to be the catcher catching that ball.
God, no.
Right? And so if we can kind of protect the rest of the community from kind of our respiratory droplets, we're doing a service for the community. So it may not be as much for protecting me from other things, but it may be really great community participation for producing respiratory droplets that may be on those high-touch surfaces or in the air.
Now, if you're feeling well, are you still possibly shedding the virus and infecting others?
And that's what we've seen in the last couple of days to weeks is that this asymptomatic spread. So this is like a person who doesn't have symptoms right now that may be infected with COVID, that's kind of spewing these little viral particles in different places, and they may not know it. This could be up to almost a quarter of people that don't know that they're shedding virus. So masking broadly can really decrease the pitchers, right? We don't want the pitchers throwing out extra balls if we don't have to and we don't know it.
We don't need the whole team out there throwing balls at the catcher.
No, definitely not there too. It does a couple of other things too, which I really like. One is that it helps to kind of send the message that I care about my community. I'm protecting everybody in the community from kind of like what I may be doing. So it's a nice social signal that like, hey, I'm not weird. I'm wearing a mask. I'm trying to protect my fellow community members. The other thing I like about it is it reminds us not to touch our face. Mm-hmm. If you got something on your face, you're not going to be as likely to kind of scratch your nose or chew on the end of your pencil, or bite your fingernails, because there's something kind of like on your face. And I like that because it really helps people to remind themselves that I probably should wash my hands after I touch that doorknob before I start touching my face.
Much better idea than spreading hot sauce all over your hands to remind you.
Bleach.
I learned that. Just doesn't work out.
Yeah. It's got a lot of merit to it. Yeah.
Now the reusable masks. I've had a few different questions on that people have asked me. Should they be spraying them with Scotch Guard so they're not, if they get droplets on them, inhaling the droplets through?
No, there's lots of different, ways that you can end up protecting, the spew of droplets out there. Scotchgard probably is not going to be as helpful because Scotchgard is kind of like a shellac, if you will. And so what you want to do is, yes, prevent those kinds of things, but it could be as simple as 2 layers of simple fabric. There's some designs out there that cut up a t-shirt and put 2 t-shirts next to each other. Even as simple as 2 sheets of paper towels have been used in South Korea and some of the other places. Anything that's more of a mechanical filter. I don't think we need to spray it with anything. I don't think we need to put anything fancy on it. Just the fact that we're stopping mechanically those droplets from flying out is a good thing.
A good friend of mine I've known her 30 years probably, works at a local bank also, posted a thing on Facebook today of a woman using men's underwear and crafting.
I've seen all kinds of things online.
Which my suggestion to her was possibly, instead of smelling through the back end of the men's underwear, maybe turn around and you've got a straw hole. You can get a little beverage in between, but probably not the best of ideas anyway.
I think I'd be a little worried about you if you're wearing, a pair of underwear on your head.
Yes. But then it's a double layer too, instead of the single layer.
Yeah, exactly. But I think you're going to see, it's now Friday. I think you're going to see a lot of the government agencies are going to be following some local municipalities and local places like Los Angeles. We saw last week, Mayor Garcetti said, let's do masks. I think you're going to start seeing, maybe even over the weekend, kind of some top-down recommendations. There's no science to this, right? Nobody does experiments on putting a paper or a fabric mask on and then doing a lot of contact and seeing if you get sick or not. That's not really an ethical thing we could do, but it's a good idea, right? There's no study with us running, with scissors, right? But we all are told don't run with scissors; it's dangerous.
I learned that.
There's no evidence out there. There's no scientific evidence, but it's a good thing to do. It's probably going to have more positives associated with it. It's slowing the curve of increase in the country. It's got certainly some concerns on are we taking masks away from a population? But if these things are so easy to make on your own at home, and you're going to be home isolating anyway, it's something to do.
Very good point.
Then wear one of these things around, and I put on the little card that I distribute these with in the hospital. That congratulations on this mask. Thank you for Project Cover Up. This mask may save you or somebody that you love in the community.
Very good. Now, there's been an employee here asked me to ask you about different pain relievers. Is there any truth to the question?
Another good question. We saw some early potential data that the way that ibuprofen works, that's Advil, Motrin. The way that ibuprofen works is that it sits on a certain receptor on the membrane of the cell, and that's kind of the lock that opens up the key for the virus to get into the cell. And so if it looks like ibuprofen occupies that same spot, are they letting more virus in if you have an infection or not? Theoretically, there may be a way that ends up happening, but again, it doesn't look like it's panning out as far as evidence at this point. Maybe as we gather more data, the World Health Organization, the WHO, put out a statement, I think about a week ago or so, that says if you're going to treat fever, maybe they steer towards Tylenol. But really, if it looks like you got a fever at home and all you got is Tylenol, all you got is ibuprofen or Advil or Motrin, treat the fever, right? That's going to be important to do. If you have a choice between Tylenol or Motrin, try Tylenol.
Now, someone else also asked me, someone that cornered me, and we were 2 feet away and we backed up to 7 feet or so.
Right.
Regarding fever, they said, fever, heat kills the virus. So until I get up to 104 degrees...
there's lots of different, opinions on this one. I will tell you, if you don't treat a fever and it gets, 105, 106, that's bad for your brain. That'll cook your brain and you'll end up with like a seizure. So I would not recommend not treating a fever if it looks like it's a high spiking temperature with fevers and chills. I think you kind of need to keep your body's defense mechanisms as well in the middle as possible. Too far down, not good. Too far up, not good. But at this point, I wouldn't recommend that you let the fever go unchecked.
And a febrile seizure, I've seen just recently a child have one of those. It's not a good
Super common in kids, yeah.
But yeah, because they were actually the ones that mentioned it to me. Gosh, did we do the right thing just letting the fever spike like that?
Yeah.
Well, the next time I have Dr. Brown in the seat next to me, I will ask him. So I did my job.
Right,
yes.
due diligence.
Every once in a while, I follow through.
Yeah, and I agree. Yeah, the other thing I wanted to mention is that as part of the the social distancing and trying to keep us apart, it's really tough to do this now because the last couple of days it's been spring. It's nice outside. We're all outdoors people, and we're looking through the window of our home isolation or quarantine and saying, yeah, I really want to go out there. And we still need to keep up the pressure. We need to double down on this. It's not time to say all clear. The message is, not all clear. We've got an ever-increasing kind of number of cases in the United States as well as our local community and our local valley. So this is not the time to let your guard down. This is the time to really double down on that containment. Keep away from folks. I don't want to see dinner parties on Facebook. I don't want to see large gatherings. And we're going to have to take a really close look at some of our large gatherings coming up in the next couple of months, depending on how this thing looks.
Yeah, we are. Yeah, we have that big one coming up. It's too early to call, I guess, but it's sure approaching the
it's
the horizon.
We hope that that we can end up sending the all clear message out, but with the rate of increase, we're looking at a target in the U.S. Somewhere on April 15th. That's like tax day. Great, what a coincidence. But around the middle of April is when we're going to kind of see the spike if our predictions are correct, and this spike isn't just going to disappear in a couple of days. Before May gets here. So we got to really critically look at what's safe for the community and the nation as far as these large gatherings.
That does indeed definitely have to be the top priority.
Yeah. If you don't have people, you can't have mule days. If you don't have people, you can't have fishing opener. You can't have large gatherings. So maybe Mill Pond is still at risk too. So it just depends. We want to try to keep people safe, keep people alive, so they can enjoy these events in the future.
Now, how's the drive-through testing going?
It's great. We've identified a clear majority of the cases that have been positive in Inyo County. Again, we're kind of moving into that containment phase. So a lot of places are really reaching out to do kind of mobile care, if you will. The food places in town doing deliveries, doing pickup. Again, great plug and a shout out to you guys for doing that, keeping us as a community fed. You've got some of the local pharmacies that are doing curbside pickup like the big cities do for Vons or Walmart and Target and whatnot. You're having the drive-through, really seeing the patients that we want to get a little bit more information on, make sure that they're not sick enough to be in the hospital but need some care and management at home. So instead of really focusing in on testing positive or testing negative, we're really focusing on triaging or making sure that those patients are comfortable or safe, have the things they need at home, that they can kind of weather this out.
So at what point should they be contacting someone and saying, gee, I know we've been over it already, but I think I need advice?
I think shortness of breath is really the main issue. I've got a couple of my patients who were some presumed positive patients that have recovered from COVID-like symptoms like a pneumonia, and really their statements were, I just had a cough, I had this high spiking temperature, and then I just was having some trouble breathing. I mean, don't wait till your fingers are blue to give us a call. If you want to get on the horn to your primary care physician, we can end up helping to test or to look at them outside of the office through the drive-in if we need to. But really, it's the fever, the cough, and the shortness of breath are still the main symptoms that you want to look for.
And then if they feel they need, I guess they call their primary care physician. They don't have a primary care physician because some people don't.
Right.
Who should they call?
Well, we're kind of handling all comers at this point. There's some good resources out there. The county's got a 211 line. Mono County's got a 211 line also that's staffed with a nurse during the regular public health hours. So those kinds of resources are a good starting point. Then if it looks like the community doesn't have the resource with their primary care or they don't have one, then give us a call.
And what number is that?
760-873-2849. That's the Rural Health Clinic at Northern Inyo Healthcare District's campus here in town.
Because honestly, I've forgotten it. So
it's in the phone book,
Speed
it's on
dial.
Facebook, it's in the internet. So yeah, and another plug to the website www.nih.org has some helpful tips on it. The county website is great. Both Inyo and Mono County have some really nice information that they've put on the site. So those are kind of your trusted resources in addition to what we're doing here with radio and TV spots.
Very good. Now, how's the turnaround on the tests?
We've gotten tons better. When I first showed up on the show, we were looking at 5-7 days. And now our turnaround time sending a lab study out is less than 2 days. So it's really been a much better turnaround. And that's really nice when you have somebody that may have been exposed like a healthcare worker and needs to get back to work to end up treating the next group of sick people. But we don't want to wait, after their sickness is done clinically. We don't want to wait, 5, 6, 7 days to get them back online if their tests are negative. So if we can test them, twice over 24 hours, get those negative tests back, and we can get them back to, work within a couple of days after they get better clinically, that's a win for everybody.
Now, back in the good old days, we had SARS, which was a coronavirus. Doesn't the lab have, as I recall from when I was there, equipment to test for SARS? Is that something that can be converted over to test for COVID-19?
The problem is that they're all different little animals, and so even flu swabs are sometimes kind of hard to isolate for different strains. So the previous SARS is not going to probably transfer over to the current SARS. So you have to very specific antibody and antigen testing for this one, and that's why we kind of got a little bit behind as a nation. We had to kind of develop that stuff and get it moving and then roll it out after it's been validated to some of the laboratories in our communities.
Okay, so what's next in the battle locally here against COVID-19?
All right, so we have to make sure that everybody knows it's here. It's here, it's community-wide. We have to work on containment. We have to work on doubling down and keep people home isolated when it's indicated if they have a positive COVID swab, or if it looks like they have a suspected case, they want to do the home isolation drill. If it looks like you're contacting somebody that's a positive, we're going to do that home quarantine. All of that social isolation seems to be working. I think it's a little bit too early to tell right now on kind of what our curve is going to be, but if we can flatten that curve from doing this big spike and we can just kind of keep this slow burn, that's a win. And if we've done our job as a community and a healthcare district getting this kind of information out, decreasing that spread in the community, then we're going to be in much better shape.
Very good. I think we've wrapped it up.
All right. Until next time.
Thank you, Dr. Brown.
You betcha, Bill.